welcome to the fourth installment of Jillian's Clinical Corner. This month's topic is handwriting. So why would we teach handwriting? First, it's a foundational life skill. This can be taught through traditional ABA methods, including discrete trial instruction and natural environment teaching, and it could benefit from reinforcement, errorless teaching, hand-over-hand prompting, error correction procedures, so many of the skills that we use in applied behavior analysis already. And handwriting is such a life skill for individuals with special needs and of typical development. So what are important factors when teaching handwriting? So I'm going to give a list, and this is based on my own experience in the field of behavior analysis, but it's also adapted from LeBlanc Penny 2017. First, know what is age appropriate. So don't ask a 3-year-old to hold a pencil correctly. Know what is age appropriate for a learner of that age. Check the developmental milestones. It's not age appropriate for a learner to be holding a skinny pencil with correct hand placement until they're 5 or 6 years old. And even at that time, it takes teaching. Also keep in mind age appropriate writing size. So we want to allow our learners to write bigger at first and then scale down to a more appropriate size. Check out some typically developing kids' handwriting and do some research on the age appropriate writing for your learner. Also, you could teach scribbling, holding a writing utensil. So remember, teach things outside of just handwriting, such as scribbling and the correct hand grip. So even though you wouldn't teach a hand grip for a 3-year-old, once you start teaching handwriting, get the correct holding of the utensil down. Work on letter formation. If you're teaching handwriting and teaching writing letters, be sure to focus on the correct letter formation, not just on tracing and it's going in the wrong direction to make the certain letters. Work on fine motor skills overall. Remember to work on overall fine motor skills to help build hand strength, such as building blocks, completing puzzles, buttoning zippers, and any other fun fine motor activities you can find. Now keep in mind, this doesn't necessarily lead to good handwriting, but some studies show that it can lead to better hand strength. So in ABA, we would probably say that this is more correlational and not necessarily causational. So just because you have good fine motor skills doesn't necessarily mean you'll have great handwriting, but one might lead to better hand strength, which might lead to better handwriting. Start with uppercase letters and then move on to lowercase. So if you're teaching writing letters, traditionally, it's easier to start with uppercase letters first and then move on to lowercase because there are more straight lines when writing uppercase letters. You would have most likely started with drawing lines first, so that easily transfers over to writing uppercase letters. Also focus on letters that are of similar structure. So a capital letter A, V, W, and X all have a similar structure with the straight lines going up and down and diagonally. You can space out the teaching and focus on one letter at a time, but they can go in that order since they're following a similar structure. Start with the child's name and then go on to the letters from easiest to hardest. I know it might sound counterintuitive, but don't go in ABC order. ABC order doesn't necessarily have the alphabet in the letters in order from easiest to hardest. So it's more important that they learn correct formation, and that would mean starting with the letters that are easier and moving on to the ones that are harder. Since the child's name is one of the main things they will most likely be writing, it's important to start there when choosing what letters to write. Then you want to move on through the alphabet from the easiest letters first, so those with straight lines, and then onto the harder letters, those with curved lines. And like we said, typically uppercase first, and then lowercase. So what does the research say? There are many articles about teaching writing name and handwriting skills to individuals with special needs, but here are a few that I found interesting. Moore et al. In 2013 found that using video modeling and reinforcement along with a backward chain was successful in teaching an individual with autism to write her name. McLaughlin and Walsh found in 1996 that they were able to teach an individual with developmental disability to write his name through the use of task analysis, prompting, modeling, and contingent teacher praise. So what's important about both of those studies is, just like what I said in the beginning, we are using the most basic ABA methods that we know already, that we're using to teach a bunch of other skills, and applying them to teaching handwriting. So video modeling, reinforcement, prompting modeling, contingent teacher praise, and a task analysis. All of those were used in the research to teach handwriting skills. So as long as you keep those other factors in mind about which letters to start with, what's age appropriate, then you could focus on using your ABA knowledge, reinforcement, and all of the other methods that we know into teaching handwriting. And then Hopkins et al. In 1971 found that access to a playroom increased the printing and writing responses of first and second grade students over baseline. This shows that reinforcement, access to breaks, attention, and tangibles may increase the effectiveness of our teaching for handwriting skills. So what is the takeaway here? Be sure to follow the age-appropriate guidelines and the guide for which letters to focus on when teaching handwriting skills. Remember to use the ABA knowledge and practices that you have in your toolbox and provide lots of reinforcement for skills learned within handwriting. As always, individualize the teaching to your learner. So focus on all of these things that we discussed here, but as with all things, individualize the teaching to your learner. Okay, thank you so much for joining me on Jillian's Clinical Corner. It's been a great time, and we will talk again soon.